It's me, Smile McGee, and I have a secret I've been keeping from you guys. This will be a high pain day because my stomach is super swollen. Look at this. I'm like 6 months pregnant. Da, 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 da. That's all hard inflammation. Beep, 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 cry. Can I just really cry? So I have a big old medical update, and I'm waiting till I get a call from one more doctor to do the whole thing and make a new video. But my GI called today, and you know how he wanted to get me in with that doctor who works primarily with rare stomach cases. Her practice is so full, she's not taking any more patients, but he convinced her to do a special scope on me that requires like a lot of special biopsies or whatever. And there was this other test to measure the amount of acid my stomach's making. And I want to cry because it requires you to have a tube threaded down your nose into your esophagus to measure into your stomach. So it's just like a feeding tube. And I had a really bad experience with the feeding tube, as you guys know, where I started like puking blood. And I had a bad experience with the bronchoscope where they were doing it and I wasn't fully sedated, so I was basically waterboarded. And the only thing in my life that legitly gives me panic attacks is having a tube put down my nose. Like, I was doing a vocal cord dysfunction therapy and I had to stop because I kept on having nightmares after having the tube shoved down my nose. And I have to have it twice in the upcoming months. I have to have a tube shoved down my nose twice. I don't know how I'm gonna do it, cause like, I'm like, maybe they can just drug me and give me anti-anxieties, but they affect the test. I wanna cry. I am laying on my bed almost crying because I'm so scared for this freaking test. And with the one test, you have to have the tube for 24 hours. I have to wear the tube for 24 hours. No, because I deserve them today. And I have enough nausea med where they should stay down. So, as stated before, I said 3 days because it's felt like 3 days. But all of yesterday and all of today, I have been on the phone making medical phone calls.
I was told when I get older all my fears would shrink. Now I'm insecure and I care what people think. My name's Blurryface and I care what you think. My name's Blurryface and I care what you think. Wish we could turn back time to the good old days when our mama sang us to sleep, but now we're stressed out.
That have been insanely helpful. Like 3 weeks ago when I was discharged from the hospital, I called the hospital I was admitted to, and they said there was basically no way in heck that I could ever talk to a doctor or get the results of my blood test from the hospital explained to me. And all I thought was, well, that's great. But yesterday I called and asked, hey, I was a patient of Dr. So-and-so and I was inpatient. Can I please get the results to my blood test? I was sent directly to his clinic and he was unavailable, but an hour or two later he called me back and explained everything. So I could have got those answers 3 weeks ago. But he is an incredible human and took the time to explain some blood levels to me, which was really appreciated. And for one of those blood levels, the metanephrine, he told me to talk to nephrology. So I sent a message to nephrology, who called me back today, and it is abnormal to have that level elevated, but typically if you have that neuroendocrine tumor, you have crazy high blood pressures, and I am on 2 meds to stabilize my heart rate, which can at times give a false positive to this blood test. So basically, we want to watch, and if I start getting random blood pressure spikes, we need to do a 24-hour urine test to make sure that I don't have that disease. So that's just kind of a wait and watch blood test. And my GI called, as stated earlier today, and he's doing a very thorough job, and I get to do tests I'm very thoroughly terrified of. I don't know how I'm gonna deal with it, to be honest. I am petrified of having tubes in my nose, and I have to have it twice, and one of the tubes I have to have in my nose for 24 hours. If anyone wants to trade bodies, I am completely and utterly willing. Just comment below and we'll set up the trade. And then hematology. Hema-freaking-tology. So if you follow my Facebook and Instagram, you'll see that I got some, in my complete blood cell count, there were some red blood cells that were completely and utterly abnormal. Here's a picture of the labs. I looked them up, and it looks like the color, the shape, and a bunch of things with my red blood cells were wrong. So I sent them a message, just curious about why these test results were so wonky, and they blamed prednisone. Surprise, right? Apparently to them, I'm 6'1", like sunflowers, and have a giraffe on my wall because I'm on prednisone. I know prednisone is a drug with extreme side effects, but it's not the devil. It's not the cause for every certain little thing, and I think I deserve more as a patient than it's prednisone. Like, I deserve you to actually try. Anyway, she said, oh, the levels are just caused by prednisone. Prednisone messes with your white blood cells, but the levels that were off on me were red blood cells. And from my understanding, prednisone causes a lot of things. It can cause brittle bones, a hump on your back, fat deposits on your cheeks, stretch marks all over your body, and early risk for osteoporosis, and just a bunch of other things that I researched thoroughly before starting the medication and agreed that the benefits were outweighed the risk. But not once in my life has it ever mentioned that prednisone affects your red blood cells. And I said that. I'm like, these levels indicate that there are issues with my red blood cells. Does prednisone affect your red blood cells? The answer is no, from my understanding. So she said that she would have the hematologist call me back. And I was waiting for that. I'm like, oh, finally, maybe he'll help me. And then she called back and said that he said he looked at my blood test. So he looked at my blood smear in the appointment where he talked to me for about 5 minutes. And, well, the machine must be wrong. All those levels the machine indicated must be false. Or it must be caused from prednisone. There is nothing to worry about. Yep, the machine must be wrong about 7 different levels. The doctor who saw me for 6 seconds must be completely right. Can I scream? Like, I shouldn't have to feel like I'm pulling teeth just to be respected as a patient, just to get the medical care I need. Like, this is utterly ridiculous. Like, this man was amazing when he treated me for my ITP, and being an established patient, I thought we'd have a good patient-doctor relationship, but I've rarely felt so disrespected and unheard as a patient. So once again, I just thanked her for her time, because I knew I was going nowhere, and I have called my primary care, and I'm asking for a referral to an out-of-network hematologist who may actually give a dang. Yeah, because I'm still feeling awful. My hands are still swollen. I've learned how to do my makeup very well, but my eyes are still swollen. The nausea is still bad, everything is still hard. And I'm so grateful for the doctors who've gotten back to me and who've cared, but the ones who haven't have been really freaking frustrating. As patients, we shouldn't have to fight this hard to get appropriate health care. Again, doctors, our health may be your job, but this is our lives in your hands. Give it the respect it deserves. Thanks for coming to my rant. But I am so frustrated, and I will just be waiting for my amazing primary care office to send a referral to a different hematologist and hope this hematologist gives a dang. And if nothing's going on, great, but explain the test results to me. Do further tests, try. Just don't blame everything on prednisone, because what if it's not prednisone? You know? I guess. Thanks again for listening to my rant. This is the realities of our healthcare system and what it's like to be a rare disease patient, and I think it's important to share. Wish me luck, and always smile on.